Hi guys, good evening. Dr. Jenny here, physical therapist and doctor of physical therapy. I'm a creator of Balance and Fall Support Group in Aging Adults and Balance and Falls Physiogen PT and Wellness. And I'm the current state advocate of Delaware for geriatrics for um state advocates talking about what is geriatrics. But tonight we are going to focus more of being a certified lymphedema therapist. So I'm also the lead therapist for us and also certified lymphedema therapist in our company. But I would love to learn more about one of our experts. He is one of our speakers in the recent Geriatric Rehab Summit. So we have Oscar Pozzoli. He is a physical therapist assistant since 1992. So we should say 30 plus years experience. And also, he is a certified lymphedema therapist under Vader technique. And that is since for almost 12 years, right? And he is also an active member of the National Lymphedema Network. With his 30 plus years, they have a wonderful clinic in New Jersey with her spouse and also a certified lymphedema therapist. You know her very well, Anna Pozzoli. Last few years ago, we have lots of lymphedema workshop and Dr. Anna, and also just recently in our summit, also one of our speakers. All right. So he is a certified lymphedema therapist and a certified PEDS orthotist. I always need to learn more.
Pedorthist.
See, pedorthist. So the
CPED.
pedorthist is like expert or certified for any footwear like diabetic footwear, and then we maybe he will tell us more about that. I think that's the first question I need to ask, right? We're very familiar, Oscar, with podiatrist, but this one is, of course, certified foot. All right. So I think we got majority of it. So Oscar, thank you so much for your time. Welcome to our podcast. How are you?
Thank you, Dr. Jenny. I really appreciate it. And hello, everyone, and welcome to our our
Interview.
discussion for tonight, for this evening.
Yes.
And I welcome questions, and I'm so happy to be here to share with you what I do.
Yes, yes. So did I miss anything on our introduction? So I know, can you tell us more anything about yourself that what I missed on our intro?
Well, no, it's just it's funny because both my wife and I, we've been together for a very long time, and my wife was the one that encouraged me to change careers. And so I kind of went into, I said, well, maybe not PT all the way, but let me try the PTA course. And I did. That was 1992, and I loved it. And one thing I did notice when I started working at the hospital was that I was able to see the patients almost every day, the same patients. And the therapist, the physical therapist, was doing the initial evaluation, the discharges, and they had so many different patients. But I got to work with the same patient all the time. So I felt like I'm blessed. I mean, I'm like, I don't have to do initial evaluations. I just follow along. And so I got to learn a lot. And so I said to myself, what else can I do? And not necessarily do I want to climb up and become a physical therapist. I said, what else can I do to enhance my PTA? And so I studied and I became a certified pedorthist because one of the things that I did in the hospital that I worked for 10 years, I did wound care. So I got to learn about a lot about pressure sores and ulcerations and how to diminish them. And footwear came about. So I learned about footwear. And I focused on that, and I went to the College of Podiatry here in New York and took courses there and became a CPED. So years later, as I'm doing wound care and pedorthic work, now all of a sudden my wife says to me, you could really help me with lymphedema. And I'm like, lymphedema? I said, wow. I'm like, I'm already bandaging. I'm already doing dressings. I said, why not? So I took a course with Dr. Vader because I looked everywhere, and I heard that Dr. Vader, same as the Foldy Clinic, are two of the best in the world. So I said, I'm going to learn from the best. And so it took me 4 weeks. I didn't have to go to Germany. I went up to Stowe, Vermont, where they came here, and I became a certified lymphedema therapist. And so, working together with my wife here in our business, we realize how important this field is. And we focus and focus, and now we just do 100% of our patients are lymphedema, lipedema, um, light wound, right? And so it's wonderful. It's wonderful. And so
Yeah.
that's where I'm at now, you know?
Thank you so much. That's really a great summary, right? Of how
Yeah.
you are an inspiration for my wonderful and awesome colleagues. I have great physical in my career. I really met a great and wonderful physical therapist assistant, and I would love them to. I like when you say that. How can you advance more of your physical therapy?
Of
As a
course. Of
physical
course.
therapy assistant, you know. So that's really your step. You step up
Sure.
to become a certified lymphedema therapist.
I
Um,
mean,
mhm,
we always hear, if I may let you, we always hear about progressing in certain professions. We hear
exactly.
about, if you're an accountant, then you move on, you can be a controller. So, in as a physical therapist, you went from bachelor's to master's to a
Yes,
doctor.
yes.
The PTA just stayed there, didn't move much. We're still there. We're in the background. But you know what, though? That's what I love about it. Because
Mhm.
instead of me thinking, let's move vertically, let's move horizontal. And so you can add a few things, into your career, and then that just makes you so much more marketable as well.
That's true. Right now, you're very independent and you have your expertise and respect, of course, in the community, you know. So we keep talking about lymphedema, lipedema, but for our listeners who
Yes.
has basic knowledge or maybe less knowledge about it, can you tell briefly what is lymphedema and
Sure.
how it's different with lipedema? Thank
Yeah,
you.
well, definitely. Lipedema is a different. It's similarity, but there's differences, right? We're dealing with fat disorder, right? Instead of in the lymphatics, we're dealing with the lymphatic disorder, right? Something to do. That's what we call it lymph. Obviously, from the lymphatic point of view, edema being that there's swelling, so we're dealing with the lymphatic system. And when you're dealing with lymphedema, you have to deal either with primary lymphedema or secondary, right? Whether the person is born being their primary, or did the person get lymphedema as a secondary, right? After breast cancer, after a mastectomy, after lymph node removal, right? Cancer, sometimes trauma. Um, with lipedema, is different. It's more hormone driven, right? And it's 99% of the time is female. So it's a hormone driven, swelling. And it's extremely, extremely interesting when it comes to lipedema because unfortunately, a lot of the women are told, lose the weight. They're literally told by doctors, lose the weight, right? And it's not a weight issue. I mean, we can have a weight issue, but it's not a weight issue. Lipedema is not a weight issue. So it's very important to notice the difference between one and the other. We have doctors that send this patient under a diagnosis of lymphedema, and it's not, it's lipedema. And then if we get into more details, you could have lympholipedema. You can have both components. You can have three components. You can be obviously morbid obesity, lymphedema, right? But also lipedema. So they're all different stages. So this is a very interesting field that, so just to answer your question, one or the other,
Mhm.
lipedema is hormone driven.
Mhm.
Lymphedema is more, right, the lymphatic
That's
situation,
true.
lymphatic
Mhm.
disorders.
Yes,
Mhm.
thank you. That's really that's easy for them to remember, especially just like whenever see. Of course, it's not easy for them to just determine because as what you've said, there is a different component. Sometimes they can be mixed in one patient per se. So with all this training, can you share more if I am watching right now and I'm very interested of learning more about lymphedema to be in lymphedema therapist. What are
Mhm.
the courses or training do you recommend, or even some although we keep reading books, but usually in these skills, it's manual. So better really a training, right? So what are the different resources, recommendations that you want to share with us? Mhm.
So I'm assuming that you already are a certified lymphedema therapist, that you already are, or do you like to become one? Is that I'm trying to understand the
So
question better.
you can tell to our listeners. So maybe let's say you can share like for us an ordinary therapist and they are
Okay,
interested
sure.
to be a certified lymphedema therapist. Yeah, that
Hmm.
would be a best question.
Oh, okay, so let's assume you're truly interested in becoming a certified lymphedema therapist. Well, I would say there are six schools out there, and I wrote them all down so I don't forget them. And you have the VODR, VODDER, the VODR technique, which is the one that I've been trained under. You also have the Foldy Clinic, both of which in Germany. Okay, these are the two I would say top. Then you have, of course, here you have the Norton School. Okay, you have Norton School, Norton. You also have the ACLS, which is the lymphatic studies. Also, that's another school as well. You have close KLOSE, close training. And then there's another one that is a combination of certification of lymphedema therapy, but also has added another component, which is also, I believe, very important, and that is the ILWTI, which is the Lymphedema Wound and Training Institute.
Institute. Yes,
Right.
yes.
And
Mhm.
so those are, they incorporate a little bit more. I find that to be quite interesting because during the treatments of lymphedema, you will occasionally find patients that are so severe that may have open sores.
That's
And
true.
so
The wound. Mhm.
understanding why, right? They're oozing, they're weeping. So you're going to be dealing with a little bit of wound care.
That's
So,
true.
but those are the schools that are, that I would recommend.
Thank
Now,
you. Mhm.
besides the school, the most important thing I believe is the National Lymphedema Network, the NLN, and becoming a member or looking them up and read about it. They'll give you some suggestion as to what to read. But being a member of the NLN is important because now you get to talk to many therapists who are members. So, sometimes sitting down and having a cup of coffee and asking questions, just like we're talking right now, oh, you get to learn a lot, and a lot of tricks too.
And lots of trainings, so that's a big resources trainings. They even share their experiences with their patients, and they have lots of different accessories, and this works for me, this works for my patients, and they will going to help you with different company that they usually use for these specific cases. that's
That
that's
is
why it's a
correct.
network. It's
That is correct. That is correct.
Yes, and that's how I meet all of you. Just I'm blessed with LinkedIn because I met lots of amazing people, and then I just put the lymphedema, and then all of you are there, and you're very active, and that's
Sure.
really great
And
resources.
that's a start. That's a start. My wife and I, we've been doing it for such a long time that now we go international. We travel to places like Italy. Not too long ago, we just got back from Genoa, which is the International Lymphedema, Symposium. We also we were in Copenhagen in Denmark, where they had also the International Lymphedema framework. We've been to Canada. So we've been to multiple places where, again, you're networking with people. This is not a huge conglomerate of therapists all over the world. They're not. You will meet people from around the world that you'll see occasionally in other conferences, and you become friends, you
That's
know,
true.
and also with the top physicians in the world that are doing new things like surgical procedures for lymphedema, lymph node transplants. I
Heard that.
mean, there is so many things that are advancing that it's a wonderful field, wonderful, and there are many people that need our help.
Thank you for sharing that. I agree. And then I have another like colleagues and expert. Um, he knows somebody like a surgeon that he is doing now lymphedema transplant. Sorry, lymph node transplants and lymphatics. And then because he is the CEO of or co-founder of that lympha, like the
Mm-hmm.
prairie wear, and then he has the connection with that. So I spoke with him too. That's really, oh, that's interesting, and then it's more on a vascular surgeon, things like that. So that's
Mm-hmm.
really
Mm-hmm.
true. And then, so I know you're the co-founder and you have lots of experience in your omnitherapy, but what makes it different from the ordinary clinic? What other
Mm-hmm.
things that you have, like especially managing lymphedema, Oscar?
Well, yeah, that's a wonderful question because I don't want to offend anybody, but when you deal with complete decongestive therapy, and that's what you're going to learn to do when you become a complete, right, when you become a certified lymphedema therapist, is to do the complete decongestive therapy. Why do I say it over again? Because there are many facilities, and I just hope that you don't know any of them, but there are many facilities that say that they treat lymphedema, but in reality, they put a patient in a pump, put them on a pump for 45 minutes, and maybe one therapist tells the other, "Hey, Charlie, what do I do next?" And Charlie says, "Well, after the pump, let them do a little exercises, right?" Or they'll say, "Not too much weights because too much weight is no good," which is not true. But and then they called it lymphedema treatment, and that is not your lymphedema treatment. That's not. And I run into this situation very often. We have here in New Jersey our clinic, and let me assure you that we have people coming from far away come to our facility because we see one patient for 1 hour. Hands on, education, manual lymphatic drainage, right? Congestion, right, which we do bandaging, right? The bandaging techniques, educating the patient, measuring for proper garments, educating the patient again. Notice everything's about educating, right? And hopefully, we call that the intensive phase. And then you have the maintenance phase. So there are two phases of this type of treatment. We focus on the intensive to bring those extremities down. Once those extremities are down, what we consider they are now the normal size or as best as we can, now we have to teach the patient how to maintain and keep that, extremity from not getting enlarged again. So we love to tell our patients the three C's, which I'm going to share with you. We say compression, compression, and then the last word we say comprende, or we say in Italian capisce, right? So they need to
Okay.
understand these things. So yeah, it sets us apart from many facilities. If you find it that you want to be, and there are many lymphedema therapists out there that would love to do what I do, what we do, but the employer doesn't let them do it
Mm.
because you have to have that time with the patient,
That's
one on
true.
one, one on one for 60 minutes.
Mhm.
And then, your other therapists are seeing two, three patients an hour. Management's going to say, Oscar, you're a great guy, but we can't do it anymore. We, at least here, and I can only speak to in our country. I don't know about
Mhm.
it elsewhere, but
Mhm.
But no, but both Ann and I, we see one patient per hour. And guess what? We
Mhm.
survive. We're okay.
Yeah, because that's your clinic. That's a good thing. You do your own because that's your own clinic. You're not employed under the outpatient clinic, which is
Correct.
following 8-minute rule.
Correct.
Yeah,
And
the Medicare things, reimbursement, that's really tough. Yeah.
sure. And this is what I say about I encourage therapists, open your clinic. Open it. Really open it. You don't need a whole lot. You need a room. You need a high low table so you can be comfortable. That's all you need. You just need a very small office. You don't need a huge practice. I tell my colleagues all the time. I said, open up another lymphedema. You could be across the street from me. I would love you because that's how many patients, we have that need this type of treatment.
That's wonderful. Yeah, because you're giving us already an idea of how to be certified lymphedema therapist. And at the same time, you're giving us like a motivation to just do this. And at the same time, the passion of helping our lymphedema patients. Speaking to our lymphedema patients, I know this it's really tough because I work in home health before and they have difficulty just getting up, moving, then go to outpatient. That's another thing, right? So that's one
Right.
of the big challenges there. And I like how you emphasize the education piece because that's skincare, then
Right.
maintenance, and then the intensive phase. That's true. And the compliance is one of the challenges. You're doing so good for them, and at the same time, they leave alone. So I said, "Oh my God, you leave alone. Who am I going to teach with this?" That's why I
Yeah.
am always blessed if I know somebody again, like accessories. I think this will work for Mr. Smith, like you don't need to wrap. He can just use this kind of bubble
Sure.
stocking, like, so that's why it's really important network. Yeah.
That's
So,
correct.
so what will be your advice for our lymphedema patients listening to you? And I will ask another one for our clinicians.
Oh, that the most important thing that we are here to guide you more than anything. Because, what sense is it for me to reduce your extremity, right, to something more comfortable? Okay. For instance, we reduce the extremity, so maybe your cellulitis will be less, your
Yeah.
attacks of cellulitis, the oozing, the weeping, maybe we get that under control. That's all great, but we need to express how important it is for them to do their part. So, in part, that's important, right? Just like you said it, right? You hit the nail right on the head when you said about teaching caregivers, family members,
Mm-hmm.
right? We'll be very surprised how many people are lonely out there,
Mm-hmm.
that they don't get it
It's so
much help.
depressed.
But you're right, we can show them, and once we have our patient, they're our patient for life. The, these patients, they go through episodes, and that's okay. It's not like, like you have a knee replacement and you teach the patient's doing good. Oh, you'll never see that patient again because now they're fine. They don't need. No, with lymphedema, it's a lifetime condition.
Yes.
So this is a chronic situation where sometimes you'll have episodes where they're gonna need to come in, and that's okay. We have these beautiful bags where we put our bandages with our name, and our special bag is a very strong blue color. Now, why do I do that? Well, part of it because I tell them, once we're finished with all our bandaging, put everything in this bag, and I want you to put this bag somewhere in the closet. So then a month from now, 2 months from now, 6 months from now, if you need to return back to me, you bring that bag with you. You see, so all of this, because it's a lifetime condition,
Mhm.
the more the patient learns, the more they participate with their care, the more the family helps, the better the outcomes.
Wonderful. Thank you.
Hmm.
Thank you so much because I can really feel that you're really like working with them. Your passion is just to help them. And then you really that they're so depressed, right, Oscar? Imagine
Full part, sure.
it's really
Oh my
tough.
God, yes, yes,
They're very strong and brave people, but imagine in their situation that when you see from before and then when you see the after, that it's really the hope will be there, like, wow, it's possible, and then I
yes.
just need to do and maintain this. It's really possible, so that gives them hope, so
And
that's
and then the wonderful thing about this field too is right off the first visit that you do, if
yeah,
you bandage these
like that.
patients, right, and you do the proper bandaging techniques, right, the next time you see these patients, if you're the one taking those bandages off, oh, you're gonna feel so good
Mhm.
because you're gonna physically see the changes, and you're like, wow, I'm doing this.
Yes,
Well,
that's
actually, the
true.
bandages are, but but you're the one that's doing this, and people can literally see it right away. And
Mm-hmm.
many of them will cry because they'll say to you, "I've had this for years, and nobody was able to help me.
That's true.
I've taken diuretics, I've taken medicine, I've seen." Today we had a patient come in and said, "I've seen 12 doctors. I've
Mm.
seen 12 doctors." And finally, she comes to our clinic. 12 doctors they saw, of which they were not helped.
Yeah.
I
Mm.
mean, that's a record because usually it's about 6 or 7.
That's a lot. Well,
Well, they go to the internist, right? The
yes.
general
Mm-hmm.
practitioner. Then the
Mm.
general practitioner sends them to who? The vascular guy, right? To
Okay,
make sure
yes,
that
we have
there's to make
vascular.
sure that
Mm.
we do an ultrasound that there's no blockage, right? So
Okay.
you have the vascular guy. The vascular guy sends them to the cardiologist, right?
Mm-hmm.
Because the vascular side says, well, everything's running fine here. Maybe it's
Mm-hmm.
your heart. So they go to the cardiologist, right? And then they go to a specialist cardiologist. And then, so we see this all the time.
Yeah, and then sometimes it's just automatic. All right, this is edema, so here's the Lasix. And then I learned that from our training. So you just wash out all those fluids, but the protein is stuck. And then, so now later on, it will swell up again. So,
That's right.
so it's just education, great knowledge, and we really love to have more certified lymphedema therapists so they can keep practice and help more people because
Sure.
they will be able to go more even outpatient setting or home health. Yeah, so that they're
Sure.
very minimal. And then how about to our clinicians? So before we close our interview, what will be your tip for our clinicians?
Oh, clinicians. Oh my God. If you think that there's so much to learn, so much to
Okay.
learn. There's so many things to do. The basic is the basic, right? Just like your physical therapy training, you learn the basics in school.
Mm-hmm.
After that, you start learning different things. It's the same thing with being a certified lymphedema therapist. If the more you practice with different patients, right? I
Mm-hmm.
mean, I do about 30 visits, here at our clinic per week. That's just me.
Wow.
30
Mhm.
patients, right? I mean,
That's so
7 or 8
tiring.
patients per day, right?
That's
If you imagine 8 patients, no, but it's not. It can be very relaxing. I am so stress free. I can see the whole patient for an hour, but because the way you do the stroking of the massage,
yes.
the way you
Mm-hmm.
do your hands on, our soft music, it's very relaxing. Very relaxing.
Oh, I
Okay?
didn't think about the music. I just think
But
of
yeah,
just
oh yeah,
doing it.
so we
That's a
can
good
we
point.
we can do multiple presentations if you like, but for clinicians definitely there's always so much, not just your hands on, doing, you're practicing, whether you're doing, you know the way you're compressing with the bandages. Should I use short stretch? Should I use a medium stretch? Should I
Mm-hmm.
use an ace bandage?
Mm-hmm.
You get to, should I use tensile grip? Should I wrap the toes? You know, there's so many things that you can do. What kind of a wound dressing am I going to put? Should I
Mm-hmm.
use an alginate? Should I put a non-adherent? Should I use honey,
Yeah.
for my wound? Should I, all these things you get to learn little by little. And when you're a member and when you're talking to other clinicians like myself and so forth, you get little tricks, right? Should I
Mm-hmm.
use shockwave therapy? Like I said to you
Yes,
before,
that's
we have a
right.
lymphopress. We have a machine here from Finland that's called, not lymphopress. I'm sorry, that's the pump. It's
Lymph
the
touch.
oh God, what's that? I just mentioned
You
to you
say
before.
something like lymph
The
touch.
lymph. Yes, yes, yes. It's a
Mhm.
machine. I can always show you, but oh, there's so much. There's so much to
Yes,
learn.
yes.
Just
Right.
gotta give you your time.
Yeah. And how about your philosophy in life? So because we're about to close this, so let's just close it. Your philosophy in life, knowing that we have you today for our interview, Oscar.
Oh wow! I mean, that's a great question. The philosophy of life. I call it the miracle of life, right? I mean, I kind of like say to myself, I say to many people, you know, I say, hey, would you like to win the lotto? People say, oh my God, or they'll tell me, God, I wish I can hit the lottery. I can. And I say to people, I say, you, but you did hit the lotto. And they look at me like, what are you talking about? I'm poor. I'm like, no, no, honey, you were born. You hit the lotto. The lotto was the day that you were born, right? The miracle of life. I mean, that is, I tell this to people because sometimes they feel that there's a need, so the philosophy of life is about understanding that you're here. And there's a reason why you're here, right? There's a reason that you were chosen to be here. And
Mhm.
so what wonderful field that we're in that we can help people, right? That we can help people. And so I feel great about it, you
Love
know?
it.
So
Mhm.
philosophy of life is just choose to be happy, to make other
Yes.
people happy, right? I mean, I think most people will say that. And this
Yeah.
is a great field. I feel like a salesperson. I'm trying to sell,
Yeah.
for people to become certified lymphedema therapists, but it's unbelievable,
Thank you.
how
Yeah.
many people you can help, and that's just lymphedema. I'll let Anna talk about lipedema.
Yeah, that's true.
Ah, that's
Last time we have a webinar where she explained and she just even like pictures and then she explained this is lymphedema, this is the lipedema. She explained even. So that's really good. Like, and then exactly something like this. And then she presented that. So thank you so much, Oscar. That's a really very deep conversation because you shared what you're doing, your journey, and then we really appreciate you and thank you for what you're doing for our community,
thank
especially
you.
for our lymphedema people. Yeah, thank you.
Thank you. Really appreciate it. I'm so thankful for being here and to have an opportunity to talk to your members, your viewers, And I would hope that one day maybe I can be walking somewhere and say, "Hey, you're Oscar. I became a certified lymphedema therapist because I heard your program."
I like that. Yeah, that's one of the biggest like I forgot that the term like recognition that you're the inspiration and the motivation for them, right? So
That's right.
that's the big saying thank you. And then also how we can connect with you, Oscar. If they heard you today, they want to learn more about it and ask more resources. So how can we connect with you?
Well, as many people do, everyone has a website today, right? So our website is the name of our company,
Mm-hmm.
Omnitherapy Center,
Mm-hmm.
right? .com. And
That's easy.
my email is basically info@ omnitherapycenter.com. They could always write and love to read and stay in touch with some people. And if they ever come around here to New York, if you ever travel to New York, I'm only 15 minutes away from Manhattan, across the river in New Jersey. We're only 15, 20 minutes depending on traffic.
Mm-hmm.
But you're welcome to come and see our facility, and
Thank
how we do things.
you. Yeah. I
Right?
have many colleagues in New Jersey. And then physical therapist. And then also a couple of outpatient friends in New York. So if they have those cases, lymphedema, definitely I'll tell them connect with them because they're already in the area. Yeah, I just think about that. So thank you so much again, Oscar. We really appreciate you. Thank you guys for listening and watching. So if you have any question for us, if you have any question and then concerns, and if you want to learn more different topics, just connect with us, okay? So again, I'm Dr. Jenny Yusuf from the Balance and Fall Support Group. I'm a board certified geriatric specialist in physical therapy and also certified exercise expert in aging adults. We love to learn from you. And if you want to connect with other like experts and want to learn more, just let me know and I would love to look for those specific experts so we can learn from them. All right. So thank you again. Bye, guys. And
Wonderful.
this is another episode of Thanks God It's Thursday. All
Thank
right.
you.
Good night.
Have a
Thank
good
you so
night.
much,
Good night.
Oscar. Bye,
Thank you. Have a
guys.
blessed day. Bye bye.